Good afternoon, everyone. I'm sorry for the delay. Thanks a lot for joining us today. And I'm your host, Sahar, and I'm having Aisha Riaz as our guest today, who is currently working as a division director at HCA. Before starting conversation, please note that this session will be recorded to be shared on social media later. We will have Q&A session towards the end, just like last time, and you are most welcome to raise your hand or post any questions in chat anytime you like. Until then, please keep your audios and videos turned off. Now coming back to Ms. Aisha Riaz, how are you doing today, ma'am?
I'm doing good, thank you. I hope everybody's good and you're doing well too, Sahar.
Yeah, I am doing great. Thanks a lot for asking, and everything is going great. Ma'am, I have read your bio and I have talked to you before as well. I know that you graduated from England and then you came here. So that makes you a foreign pharmacy graduate. And everybody knows it's not an easy process, tried and tested. So you have to go for all the exams and starting from ABC when you're taking FPGE exam. And then another roadblock is to go for internship, finding an internship. After that, you get licensed, and only then you're even able to apply for a pharmacist job. My question is, how was it for you 25 years ago when you started your process?
Well, like you shared, not easy at all. When I think back at it then, now it feels like it wasn't a big deal, but when I was going through it, it felt like it was the end of the world for me, honestly speaking. I did come here as a foreign graduate. So when I first discovered what I had to do to be able to get my licensure, it seemed like a monumental task. But I had a drive and I had a passion that I wanted to get this done. I'd been in university and spent my education, and now I wanted to be able to work in the US. So just things were a little different then. There was this thing we now have called the internet, which I did not have back 25 years ago. So finding information about the exam, what I had to do to be able to, what's going to be on the exam, any information, any resources was challenging. So I had to do the FPG EAT exam. And then at that time, it wasn't on the computer. So you had to actually go to Chicago. They had a couple of centers, and Chicago was one of them. In a suburb of Chicago it was, that I had to go do it at this convention center, and you have to actually travel. And I was in Houston at that time, so I had to travel. And the US was a new place for me. So, getting that exam first of all cleared, finding the information to be able to study for that exam, and then taking the NAPLEX thereafter. And then obviously the TOEFL is what I did first before I did the FPGEC. So not easy at that time either. And I did not have anybody. I did not know anybody. I wish they had WhatsApp then. It'd be nice to have vent with others, or share resources, or even try to figure out what's the best thing and what's the strategies to study. But anyhow, 25 years later now, I feel blessed. Was able to complete that challenge in my life, and trying to secure an internship was also not an easy task, because the sites had students from pharmacy schools, so they already were saturated. Trying to make phone calls, trying to land a internship was quite hard as well. But now I think back at it, it happened. But at that time, it felt like it's never going to happen. So once I've cleared all these exams, now finding an internship will be the biggest challenge. But thankfully, I overcame that, and here I am.
I actually felt like I am listening my whole story, my own story from your side, but only the fact that yes, we did have internet and WhatsApp, and there are so many groups that are very helpful for the preparation of exams. But yeah, I cannot even imagine taking this exam without internet, and that's crazy to even think that you cannot even take exam in your own city. You have to travel out to another city and then take the exam, so it's exhausting as well, and that's definitely even more difficult. So you are not a U.S. graduate; you're a foreign pharmacy graduate. So how did you land your first job in U.S., and what really helped you in finding a job, even as an intern?
Well, as an intern, like I was sharing earlier, just getting the exams cleared and then trying to be able to find a place who would be willing to let me do the hours, have a preceptor available that would, sign off on my hours. So I would sit there every day, call, and, just get dead ends. I'd leave voicemails. People don't call you back, and didn't have a cell phone then. So, if you leave a message for someone and you just stay at home waiting for someone to call you because you don't want it to go to your voicemail, eventually, after making lots of phone calls, I happened to get an opportunity at a hospital here in the medical center, women's hospital. And it was interesting when I reached out to the director of pharmacy then, and I shared what I wanted to do. And, I was going to be free labor, and I'm not asking for money. I just want to be able to do my internship hours. And so he was nice enough. He asked me to come in for an interview. And so at the end of the interview, that lasted almost 3 hours. That was a story on its own as well. Then he asks me, "Do you want the position?" I'm like, "What do you mean I want the position? I'm desperate for someone to get me the hours." So he said, "Go home and think about it." I said, and I'm thinking to myself, I said, "I have nothing to think about. I definitely want this position." So my life started there as an intern. I worked for 5.5 months. And to answer your question, how did I land my first job? I landed my first job while doing my internship. I was offered an opportunity to take on a staff pharmacist position that had become available even before I got my pharmacist license to be able to practice here as a pharmacist in Texas. They offered me a full-time position, and I already knew the setup. I knew it was close to home. It was just like a blessing that it was right there for me. So my first job was at the same place I did my internship.
Nice, nice. So yeah, I think every person who tries to find a job, it's pretty much similar. I remember someone telling me when I was trying to find an internship that, print a lot of resumes and get in your car and, you know, go like each, go pharmacy, go pharmacy to pharmacy, drive there and, personally drop your resume. And I was lucky enough to find internship probably from three different pharmacies, but I do know that it's not very easy. It's very difficult, and especially considering the pharmacist market, it's itself getting so much saturated. But I have another question. You have your career path and everything. It's very great. I think everybody who would like to have a pharmacy career that would really like to follow your path. So in your career, which role did you enjoy most and why?
Um, my role, like I said, I started off as an intern. So in that same role, and in that same hospital, I was, worked as a staff pharmacist. So got to know the operations there. And through the years I worked at the hospital, I was able to get promoted in different roles. I mean, I started the unit-based practice there, going on the floors and interacting with the physicians and the nurses. That was a new concept that we were trying out. And then to answer your question, the role I enjoyed most was probably, I don't say probably, I think definitely the one when I was promoted to lead pharmacist. They created this position because we were implementing bedside barcode scanning, medication barcode, like at the bedside when nurses administer medication. So that was totally a new concept. So they created this position. I rolled into that position, and I truly, honestly, if I think back at what I enjoyed the most, was that because it was a truly new process. I was responsible for training pharmacy and make sure our systems were in check. Um, I just felt like my brain really functioned that way. I felt like I really could. Um, it was a great opportunity for me to be able to, it was more like a project. So I had to do the background work, set up all the databases, get staff trained, prepare the training material, and then see a successful completion, it was it rolled out really, really well. And it's something that we still use to this time. And this was back in almost 2003 was when we were working on this. So it was very, very new at that time. A lot of medications weren't coming barcoded, even from the wholesalers. So we involved unit dosing and barcoding medications at the pharmacy. So to have the right equipment to be able to do that. So everything that left the pharmacy. So that position of mine and more like an IT related position was probably what I've enjoyed the most in my entire career so far. It was just a lot of fun. It was learning and training, and I enjoyed it thoroughly.
Interesting, interesting. And definitely when you get more challenges, you actually feel more fresh and energetic to, uh, really prove yourself best in that particular area for the projects. And it always makes you fresh when you are having an extra project or even a special project that is designed for you. So you were working as a market director at Women's Hospital and then as a division director at HCA. So what is the major difference between in these two roles that you?
So, yeah, I was a market director, which means I had more than one facility I was responsible for. So, at the same hospital that I started my internship. Over the years, I worked my way up and I was promoted to director of pharmacy at the same hospital. So I would say about 10 years into my director of pharmacy position, our company was opening up a new hospital in the Houston area in Pearland. So when that position got created, I was asked to take over the responsibility of opening that hospital's pharmacy. And so both hospitals became my responsibility, hence the market director role. And then now I'm currently division director of pharmacy. So it overall, the biggest difference is the scope of practice and responsibility. So when I had two facilities being the market director, and now there's 18 facilities within a scope of practice for the division that we
It's
fall
impressive.
in under HCA, which is our Gulf Coast division. So we have 18 hospitals that fall under our division. So the biggest difference is that the number of hospitals you have oversight for, and out of those 18 hospitals, I have 7 of the hospitals that have a direct one-on-one reporting responsibility with the pharmacy. Other than that, I just have I have to do a lot of regulatory compliance assessments for these facilities, and some of them are in Corpus Christi and then McAllen and Brownsville. So I get to travel to those locations as well to do site visits.
So the travel is like, how much is the travel? Is it like 25% or most of the time you're traveling? What kind of?
No, not most of the time. It's scheduled and structured unless obviously, an emergency comes up or situations come up where I may just have to, it's a last minute thing, which is very rare that that happens because
Mhm.
we have very well functioning pharmacy departments. I don't need to be there to have the hospital run. I mean, I'm there to do a lot of the audits. So I would say maybe about 15%, 20% of my time in a year, I'll have to go there maybe 3 or 4 times. So it's
Okay,
not too frequent.
not too frequently.
Yeah.
Okay. So I am sure, looking at your title and everything, I'm sure you must have interviewed several pharmacists. So during interviews, what do you really look for, or what is the one quality that attracts you most in any pharmacist or a candidate that is applying?
That's a great question, and I hope the attendees will hopefully find benefit from there. Job interviews aren't, nobody enjoys being interviewed. It's not something I can't imagine anybody saying, I just love to go for an interview every time. I mean, it's very stressful because you really want that job.
Mm-hmm.
And it's great going to a job interview when you have a job already and you're just looking to supplement. But when you don't have a position and you really want to get into the door, I can imagine, having been through that myself, it's very stressful.
Mm-hmm.
So I look at candidates that are, when the question and answer process, that based on questions asked, and I'll share with you the types of questions I asked as well, just so people can have an idea. I look for someone who's a self-thinker. I think I look at people who show initiative when they answer the questions, and you can get an idea that they're people that think outside the box. So you don't want that typical answer like, I'm a team player, I work hard, I learn quickly. So what I tend to do when I interview people, I ask situational and behavioral based questions. So you're really looking at how does somebody respond given that scenario versus the typical questions, what do you want to do 5 years from now? Or how do you learn best? I want to give them for them to give me examples of opportunities they've had where they've learned from their own mistakes. So in that process, what I also like to look at when I'm interviewing somebody is, how do they handle their own flaws? How do they turn something negative about them into a positive? And so who can sell themselves to me? So, be it pharmacists, technicians over my years, even like we do a lot of, at our facilities, we do like group interviews, even for senior leader positions, even like chief operating officers. So we have different directors from different departments interview people. And you're always looking at the candidate that really stands out. And what makes someone stand out? It's how do they answer the question? And scenario-based questions, I feel, is the best way to find the best candidate suited for the role that you're looking for.
Right, right. Um, Thanks a lot for asking that, answering that question. I was wondering, else than PharmD, what other type of certifications you think would, and help any pharmacist to land a position in a hospital? Is there anything that can, else than, I mean, obviously PGY1, PGY2, even that requires at least some experience working in a hospital. So is there any certification that helps?
Well, if having a master's would definitely make you more marketable. You're looking to build your resume. You're looking to make yourself more of a desirable candidate. So what makes that? I mean, are you asking for a role like in a leadership role? Is that what you're asking for? What kind of certifications would be beneficial there?
No,
Like a
not
director
really.
role?
Not really. Actually, there are certain certifications like consultancy exams from BPS. I know they require, like, you have to spend time with the similar patients. Let's say if you are going for a cardiology, you will have to have seen, cardiology patients at least 50% of the time. Even if you are working in a community pharmacy, you can do that because you are interacting with the patients who had cardiac diseases. And same with the oncology. And so there are certain certifications out there for the consultancy. So I was wondering if that can help, or
Yeah,
it's
any
not really helpful.
certification is definitely beneficial. Overall, sometimes positions come about where it's not about the certification. You look at the person's experience and what qualifications, which sometimes is not just having that certification. Certifications are essential. I mean, I feel like they make you more marketable.
Mhm,
They build up your resume. They make you stand out in a pool of applicants for sure. So like if someone's applying for a leadership position and they have an MBA,
mhm.
and they have work experience, it makes them more of a desirable candidate versus someone who doesn't have the hospital experience but has the MBA, but they've never worked in a hospital, yet they only have retail experience. They may not be the most suitable candidate because hospital operations are a little different than
Different.
retail.
Mhm. And I also heard that the IV certification, it also helps, sterile compounding certification, that also helps to land a job in the hospital. That's another
Yes.
kind of certification I was looking for.
Yeah, so IB certification, and I'm glad you mentioned that. So in the state of Texas, as of the most recent requirements, and it's changed over the years, and especially with the whole event that happened with NECC, FDA, state boards of pharmacy across the nation have changed their requirements. And so State Board of Pharmacy now requires that any person who's works in a hospital setting and is involved with IV, be it even a pharmacist checking IVs, you have to be IV certified. And you have to be ACPE IB certified. In the past, we used to be able to in-house certify people and check them off. That's no longer, so someone has to come to you with the ACP IB certification, which you can carry from facility to facility.
Mhm.
And then you have to, when you start at the hospital, you still have to have the checkups and everything to be able to, make IVs or check IVs. But IV certification, I'm glad you asked that one. That would be for a hospital.
Mhm.
That would be a plus, a pharmacist or a technician. I know I do not even look in any resumes if they're not IV certified because that's just,
That's a
it's a job
mandatory,
requirement.
basically. That's a
Yeah.
mandatory. I see. So one last question is that what is one advice that you would like to give other pharmacists that are seeking opportunities in the area where you are working, like in the hospital segment?
Um, Advice I would have is, unfortunately, the situation is that whenever you apply for a position, people are looking for someone with experience. How do you get experience without having, you know, being able to work in that setting? So looking at volunteer opportunities, and lately, and just because of COVID, obviously right now it's a very challenging time to get your foot in the door in a hospital. But if someone is willing to give you those hours, avail that opportunity, do the best that you can. It's the opportunity where you really get to show what you're able to do, and it's your opportunity to learn. So stepping out for me, like when I think about what helped me, what made me be able to grow in my career, was just the desire to want to keep learning more. If I know this, then what else do I know to be successful for that position? Just taking on extra projects, even in your current position, looking at if there's a new rollout coming, what would make you more, what would help? And unfortunately, people look at it, what's in it for me? Why should I do it? They're not paying me any extra. That mindset doesn't help you be successful. Just learning, and if you have to go in, sometimes overtime hours would be available. Sometimes if you're working in that place, or if you're volunteering, coming in extra, just trying to learn more about the project that's being rolled out, becoming a super user. Then you train others, and you're just more wanted. Make yourself more of a desirable candidate. What makes you stand out amongst the rest of the people?
Definitely. And also, I think learning part is one best thing that you actually get from volunteering. And I think you also are able to make connections. And when you
Mm-hmm.
meet right person at right time and you are able to impress that person in your career path, I think that helps a lot. That can actually help you in landing a job. And definitely volunteering is the best way to get experience in an area, a competitive area like a hospital segment. Thank you, Ms. Aisha, for a very informative first session, and we will now proceed to questions raised by audience. I will take questions one by prompting your name and requesting you to turn on your video or audio to ask questions. Please be advised that if you are on video or audio and not on chat, then please turn your videos and audios off once your question is answered so that next person can take your place. So I don't see, okay, I see Ihtishamul Haq that he has raised his hand, so I will ask him to start the video. Um, Here he is. Ihtisham, I think your audio is off, so you will, yeah, thank you.
Can you hear me now?
Yes,
I'm
I
at
can.
work. Uh, okay. Assalamu alaikum. Thank you for the session, and I really appreciate your efforts, Sahar and Miss Aisha. It's good to see you, because I remember we had an event like a few months back, I think in Webster, but I was not able to be there. But I heard that you were really you were helping, and you're kind of guiding the young pharmacists over there. So thank you so much. So my question would be about the transition in the career. What do you think on this in that position? How soon a pharmacist like me working at a community pharmacy, how soon should I make the transition to get into the hospital setup? Like, should I do it like immediately as soon as I start my career working as a retail pharmacist, or should I get an experience of 1 year, then I apply for the position? Because sometimes they ask you to be an experienced pharmacist, So what would be your advice in this case?
So that's a great question, and there are different ways of looking at it. My personal take on that is uh, pharmacists who've had exposure in community pharmacy, more than likely, that's by choice or by default, that's the first place that they got their job. Now, it varies from candidate to candidate. Some people who work in community or in retail pharmacy would never want to work in a hospital. They're just very comfortable working in a retail setting. And there are times when a hospital pharmacist, it's very difficult to make a transition once you've become used to that environment. My own personal experience has been when I've hired somebody from retail who really wants to get more clinical, wants to be in the hospital setting, that's what they desire. But if you wait too long sometimes, and I'm not talking about not getting the opportunity, it's your own experience. And you become so set in your ways working in retail that the transition becomes very challenging, because they're very, very different practices. My biggest one thing, and I'm glad you asked this question, Hatisham, because one of the biggest challenges, I have given pharmacists opportunity that want to move from the retail to hospital, but I've had a couple of really, really bad examples with the transition where it did just not work out. And one thing, I really sat back and I thought there was nothing wrong with the candidate. It wasn't that they didn't have the skill set. It was what they got used to with the mindset. So for example, and this is again, I'm not sharing any names or anything. I just wanted to put this out there. In a retail setting, you work with, you, maybe another pharmacist and a couple techs. In a hospital setting, you really have to know how to work with people, and you have to be able to let others give you direction. And where it became challenging for this particular pharmacist, and I've had a couple of incidents like that, they just could not, they just could not deal with the fact that others were giving them direction on what needs to be done. And so anytime the transition can be made, there is no hard and fast rule. It really depends on what do you want your long-term goal. My recommendation would be, if you do want to transition to hospital, don't wait too long, but keep your foot in the retail door as well. So keep maybe a PRN position or a part-time position where you're keeping both skills, and then eventually make a decision. What is it that you enjoy doing? Because I'm a firm believer, you really have to enjoy what you're doing. And I know we all have to work to earn a living, and to keep the bills paid, but you also have to enjoy what you do. Does that help answer your question?
Yeah, thank you for your advice. I appreciate it. Thank you.
No problems.
Thank you, Aisha, for answering the question. I think another thing that came in my mind just when he asked the question is that when you try for rural areas, it's kind of easier to, I think, get the position, because there's, in rural areas, there are not many people willing to go, and that's why they take you easily. And also the night shifts, not many people are willing to do the night shifts. And if you try for night shifts, even as a PRN, it's really helpful, right? Am I right, ma'am?
Yes, and again with night shift, now it depends. In a rural area might be better. Now, if you have no experience working night shift as your first pharmacist position in a hospital, is not something I would recommend, because you would be the only one, and especially if you have like a pediatric unit, or there's a lot of stressors. Unless you had a really good training program before they put you into that position, is what I would recommend if anybody was seeking that avenue. But you bring up a very good point, Sahar. And one of the versatilities in candidates, and I know night shift isn't for everybody. You have to have a special a desire to, or a need to, or mentally prepared, because it changes your own work-life balance is going to be totally different for your family as well. Like I've had a couple of times where I've had, people who say, oh, I can't work night shift. I'm not saying, that will be your regular shift, just picking up a shift to help out. But some people say, I can't work it. So I've even had people tell me, oh, my husband won't let me work nights, or my parents don't let me work nights. That kind of candidate, that might be the case, but word it differently. Don't tell your prospective employer, I can't work because my parents won't let me work nights because I can't be out late at night working. So I've actually had people tell me that in the past, that I can't do night shift because it won't work. I understand it doesn't work for everybody's family, but that should not be how you convey that answer to your employer.
Definitely. Absolutely. So another question is from Rania. And this question is, how would you suggest someone without hospital experience to start working in hospital pharmacy? I think we have partly covered that, but if you can explain a little more.
So a couple of things. Houston, especially the medical center, is really, really hard. And hard for multiple reasons. Forget COVID. I know hopefully we're going to go over this hurdle and we'll resume our normal lives again soon. But getting into the hospital is challenging, and I'll tell you why. Even before the COVID, between HIPAA requirements and health requirements, because if we're going to have a volunteer in a hospital setting, we have to make sure they have their hepatitis B titers, their TB skin test, and the hospital is going to pay for this. So if someone tells me they want to come and volunteer once a week, and they'll be there for a few weeks. I'm going to spend the money to get that testing, the health testing done, and that candidate. So you have to be committed to give a decent amount of time. Could be maybe 6 months, whatever. You can't just come in and say, I want to just come in for a month. And so with the HIPAA requirements, with the health requirements, it becomes really hard to get the volunteer position. So maybe to your point, you said, Sahar, rural areas, hospitals, and smaller communities where they don't have a big workforce or a load, they will be more willing to take volunteers than you would at a medical center hospital because of just the volume, the sheer volume with personnel and the influx they have. So someone who's willing to work in like a rural area or an area a little far for you to travel as well would probably be a better option, and you'd probably get more of a response from such facilities.
Thanks for asking, Aisha. And definitely RHCs, and I think even federally qualified healthcare centers, I think that is another option to look for. I think it's relatively easy. But anyways, moving on, for the next question is from Maysoon, and her question is, what are your recommendations for those pharmacists who is struggling to find a job as pharmacists? And what are different routes, certifications, degrees, etc. they can do with a saturated market?
Yes, the saturated market has been in place for a very, very long time, at least in the Houston market. Houston, I mean, many years ago, I remember Dallas, I know Walgreens was hiring retail pharmacists and signing them with BMWs, leasing them BMWs. That's how the market was, not really that long ago. And Houston has been saturated for a number of reasons. This is the fact that we have two main pharmacy schools just in this city. Despite the medical center, and you would think there'd be vacancies coming up. With our profession, also people don't tend to retire. We get a lot of tenured pharmacists as well. So this market is challenging. Again, areas where they have a need. South Texas still has a very flexible market. It's not saturated there. Houston definitely saturated. If you are willing to move, relocate, or even I know I've come across pharmacists in my travels to South Texas that do 7 on, 7 off, and they live somewhere else and they travel, they come and stay in a hotel and work at the site for 7 days and then go back to wherever they are from. So people do all kinds of struggles. Houston, unfortunately, and I unfortunately don't have a good answer unless you have a network that you can network with somebody to which again is based on your contacts, volunteering, getting your name in there, somehow getting your foot in the door, and making these contacts is how you probably be able to get something in this Houston market. But rural areas outside Houston, it's still a little better in the state of Texas at this time.
I hope you have your answer already. So I was looking at her message. She actually have another question, which is why hospitals hesitate to hire pharmacists as pharmacy technician. Is this a good option to get hospital experience working as a technician?
You're saying in terms of getting internship hours, or just is the question?
I think most of the time it happens that the foreign pharmacists come here, and while they are, getting all the exams done and everything, they try to get into hospital as a technician, and so that they will have a communication. They will have connections before they actually get their license, and so that they connect. Yeah, so is it something like
I think it makes you very marketable. Talk about networking opportunities. Excellent. If you're a good candidate, you can sell yourself with your hard work. It has happened. I've had a couple of examples. Even if I didn't have a vacancy in my department, at least I can ask another director if this candidate is good. So they're hardworking, they're willing to take the extra step, they're dedicated to their work. Being a technician, if you can find a pharmacist or you can work with your coworkers and learn in the process, nothing like it. That's probably, if you have a technician certification, I would certainly go with that opportunity if you're able to. But again, it's finding that opening and vacancy.
Definitely. So another question is from Ruxana, and she's saying, what are the future prospects in the field of pharmacy? What trends do you see developing over the next few years?
Trends definitely that I see, at least in, again, my experience is hospital. I've never worked retail, so I'm again going to answer that question based on my experience in a hospital setting. It's very, the way it's going, pharmacists will still have opportunities based on what your skill set is, what your desire is. For example, our company, we have centralized order entry pharmacists. So these are pharmacists that work from home, entering orders for facilities throughout. So you could be sitting here in Houston entering orders for a facility in Austin or San Antonio or Dallas, because we have hospitals all across the nation. So we have zones that we divide up. So pharmacists are working from home, entering orders. What that allows us to do at the hospital is the pharmacist at the hospital is now working on the units, rounding with physicians. So especially now, the way healthcare is going to be, especially post-COVID, and how reimbursements are going to work out, I do see pharmacists probably in the very near future being very integrated in the operations from a clinical perspective, and hospital, like pharmacy, central pharmacy-based activities will be outsourced to outside the pharmacy, except for the, you'll have to have the IV room compounding checked, you'll have to have the operations, but order entry, like I gave you the example of our facility, we've been doing that for a number of years. Majority of our orders get entered off-site, and the pharmacists on-site are responsible for the clinical management of patients, pharmacokinetic dosing, or cost cutting, looking at high cost drugs and seeing what could we do to, because it's all about, especially in the hospital chain I work for, it's for-profit hospital. So you're looking at how do you manage costs, because pharmaceuticals are a big expenditure, and how can we control, just because a new drug is on the market, does that mean we add it to our formulary? And if we do have it added to our formulary, doing the drug utilization evaluations to assess, is it appropriately being used? Is the developing criteria for appropriate use? So that's where I see pharmacists really getting more and more ingrained with the activities around clinical operations.
Okay, so thanks a lot for answering the question. And Roxana has another question. She says that as an experienced pharmacist and recruiter, how do you see the future of pharmacist job market in Houston, Texas, and in other states? And what advice do you have for foreign graduates and new graduates who have a hard time finding a position? I think a lot of people have this exact same question, that if we are trying to find a job and we are not getting it, what we can really do to actually secure a job position.
Yeah, and unfortunately, I wish I had the best answer. It seems bleak right now. It's depressing. The way this industry is, especially in the Houston market, and it's been like this for a number of years. Just to give you an example, when I have a requisition for a brand new pharmacist position, even a technician position, it's not even just for pharmacists. You put in one requisition, and within minutes of it being posted online, through whether we're posting it through our website, or then obviously it goes to Indeed and various different avenues that it gets posted, we get at least, I know in an hour or two, because I was trying to fill a position where I was very blessed. I didn't have many vacancies. I had very tenured staff, and people left because they're moving out the state, or they left for various reasons, not because they were looking for better opportunities. I was very lucky that way. Whenever opportunity would come up, I put in the application, I get 50 applicants. Not everybody was qualified. Within less than a day of the position being posted. And you have to screen that application. So my recommendation is, sometimes, like you mentioned earlier, Sahar, like driving around, dropping off your resume. There's different ways to look at it. I won't recommend that, because sometimes you can be annoying by showing up at the door with your resume. Mm-hmm. And it depends on, how are you doing? Are you making a point to get in the pharmacy? Because, pharmacy is a secure area as well. Some pharmacies have reception area. And again, I'm talking about hospital pharmacy here. That's where most of my experience is. So you have to be very careful about how you approach that, because I've had people show up in hoodies dropping off resumes. And to me, I was like, if you dressed up and made an effort to come drop off your resume
Right.
with tracksuit bottoms and a hoodie, I'm thinking, I don't know if you're going to be the right candidate. So you already off-put me. And first of all, it's all about the etiquettes of applying for a job. I thoroughly recommend, you can come across annoying, but there's a right way to do it as well. After you apply, call that area and say, I'm sure you get a lot of qualified applicants. And there's ways of that you probably just get voicemail, but at least you made that effort to get your name known. Like I said, 50 applicants for one position in just a day. So imagine someone has to screen it and they look for keywords. When people are looking through your application, they're looking at certain keywords. So your application has to stand out. And how do you make that happen? So making that one phone call saying, I applied for this position, I'm very interested, and I would love to talk to you about it, and this is what I've done. Just a very brief message, even if you have to leave a voicemail, is what I would recommend. Sometimes that can go a long way, because if someone showed that interest, because some people apply many places and they put in that same application, and do not ever send a cover letter that's so generic that has gone with every application, because that, I've had a couple of examples where another facility's name was mentioned on the cover letter and they submitted it. That does not look good for you at all.
So basically it shows that you did not do a research on where you're applying, and
Yes.
you just basically copy pasted the same thing for all the job applications you're applying for.
Exactly.
Right. And yes, if you are planning to drop off your resume and driving pharmacy to pharmacy, you should be making sure that you are not appearing in a hoodie. That's a very good
do not
advice.
show
And
up
yeah,
in like
because
casual, make an effort to at least look presentable in case you get pulled
exactly,
up.
because you are getting very small period of time where you can actually present yourself in a good manner. That actually helped me better, because I was trying to be as professional as I can. And I personally, it helped me a lot. But if you're not being professional, then this is not a way you can do it.
Yeah.
Definitely not. So another question from Ihtisham is that when does the PGY timeline opens to apply and get qualified?
Now that'll depend on what you're trying to apply for. So some usually, and it depends on what kind of opportunity you're looking for. And usually in hospitals, I know a couple of our sites have residency programs, and it all depends on what program you're looking for. So I can't really answer that without knowing what specifics are. Usually summertime is when most of them start getting filled up.
Just a question from myself. It just came into my mind that is there any specific requirement that you have to be graduated from ACPE accredited pharmacy school, or foreign graduates can also apply for the PGY1, PGY2?
That's a very good question.
Yeah, because
and
a lot of times,
find out the answer, and I can ask around to find, because technically once you're a foreign pharmacy graduate and you've passed that exam, then you're equivalent of a US graduate once you've completed that exams. I do not think it should be an interference. I can't think of anyone I know that's done the residency with a foreign graduate, but I'm sure there are opportunities like that. But because you've done the foreign equivalency, so your degree is now a US equivalent, so it shouldn't hinder you from getting a certification, unless in the requirements for that they have very specific requirement that you have to be from a US-based university with ACPE accreditation. It depends on how it's worded.
Right. So if let's say I'm not applying right now, but let's say if I open a job opportunity and I see it says that you should be from ACPE accredited, you should be graduated from the ACPE accredited School of Pharmacy. So should I go and apply for it, or should I not apply at all?
It depends on how it's worded. If it says, like a lot of times, we'll have a job application will say hospital experience preferred.
Not
the difference
required.
between saying hospital preference required. So it depends on how it's worded. Right. I don't think there's anything wrong. Just like I gave you the example of getting those 50 applicants.
Right.
Not all of those applications are qualified for the position. So I don't think it hurts applying, but it's if you feel you're really suited for that job, you just have to make that extra effort of finding out how to get yourself in that door.
Definitely, definitely. It was a very informative session and it has come to an end. So thank you, Aisha, once again for sharing valuable information with us. And thank you everyone for joining us today. It would not have been possible without support of you all. And I will be soon back with another guest with another session. Until then, be happy and stay safe in this pandemic situation. And have a great rest of the evening.
Thank you.
Thank you so much.